All right. Welcome, everyone. I don't know how many people are online right now. Um, for people who are online, if you want to send a thumbs up or a big heart or a happy face just to show that you're here and that my stuff are working. Or you can also leave a comment at the bottom. Let's see if it's going to work. Mine is working, so that looks good. Perfect. Gian, can you say hello? So we just want to make sure that we
Hello,
hear you. There you go.
I'm here.
So if you don't hear Gian, just let us know. But if not, we're gonna say that everything is all right and we can start this podcast. So before we start, let me just fix this at the bottom. If you want to join us during the podcast and you would like to uh, join us on video and ask the question directly to us, you are more than welcome. Just download the link below. And you know what? Since it's not working on my screen, I'm just going to put it on Facebook. And you guys will know what is the link to join that meeting. So what's going to happen? It's the second you're going to download the Zoom application, um, you're going to have to join the meeting, and then you're going to be on the waiting list. As soon as we're done with the presentation, you can obviously connect. Well, we're going to make you connect to the meeting, and you can ask a question live to us. If you're too shy and you don't want to ask a question live to us, what you can do is just send your question or in the comments below, and we're going to read the questions during the podcast, and you guys can we're going to not forget you. Don't worry about that. So my browser is a little bit slow right now, probably because there's like 250,000 people on this podcast right now. I'm pretty sure that's not true. So guys, you will have the link. Just give me a sec. um, if it takes too long, what we'll do is I'm just gonna start the podcast, and you'll see the link um, later on. So look in the comments to have the link for the Zoom meeting. Now, with that said, this week podcast we will talk about the PFS, so the patellofemoral syndrome, which is also called the patellofemoral pain syndrome or the runner's knee. It's an injury that happens obviously to the knee. So, to the people who are listening right now, give us a thumbs up. I don't think a thumbs up would be appropriate, but if you did have some knee pain in your life, so if you did, just give us a thumbs up on the comment on the Facebook page. I just want to see if there's some people that did have that in the past. Oh my. It's it's freezing on my side, so I don't see it. Um, so how it's gonna work for the podcast is we're gonna start presenting the patellofemoral syndrome, and then at the end we're gonna take some questions and do some other comments. There you go. Now I have access. There you go. So all right, let's start this. So, even if there's not a lot of people who are saying that they didn't um, got a knee problem in their life, it is one of the most common injury in the military in the Canadian forces. And just here in Wainwright, I do have some little stats on my case. The stats that like the health services are referring to me. The lower body injury is really common. 45% of my caseload are related to the lower body injuries, and 25% of these injuries are knee injuries. So it's a really common injury, and that's only since 2016, since I started that work with PSP in 2016. So I'm pretty sure it's even higher. Gian, do you have any stats from the health services about um, knee injuries, or did you have a chance to look for that?
Not numerically. We definitely, patellofemoral syndrome, though, is our leading cause of referrals CF wide for physio. So it's a really, really common issue in particularly the recruits, I would say, for sure. Yeah.
Yeah, for sure. So what we're going to do today is our goal is to try to explain what is the PFS and also what is the cause, the symptoms, and give you some exercise that you can do at home during this quarantine period. So we're going to try to do that in 30 minutes. That's our goal. So if you do have any questions and stuff like that, in 30 minutes or a little bit less now, you're going to be online and you're going to be ask your question to us. So we're going to have a couple minutes to answer your questions. So let's do this. That's a big challenge for
All
us,
right.
certainly for me because I talk too much. So let's start already.
Okay.
So Gian, can you start by explaining what is the PFS?
For sure. So I have a knee joint here. Obviously, our patella or our kneecap is the bone on the front part of the knee. You can see that the undersurface of the kneecap is not flat. It's actually contoured if I move it. And it sits inside of a groove that matches in its contour. It's basically just the reverse. When our knee straightens, so when we go to kick a soccer ball, when we move from sitting to standing, when we climb stairs, what happens in order to straighten the knee is our quadricep muscles, our thigh muscles contract. When they contract, the knee straightens and the kneecap should slide straight up and relatively straight up and down inside the groove. So if those of you who are watching, if you can just position your knees flat, straight rather, with your heel resting on the floor or resting on your desk or what have you, but your thigh does need to be relaxed and the knee straight. If you grab your kneecap on either side, you can push it back and forth really easily. It wiggles around. It kind of feels gross actually.
I don't
Now,
like that
if you put a
feeling,
little
but
bit of
yeah.
no, it's kind of gross. Yeah, it is. So now if you put a little bit of a bend in your knee, say 30 degrees of bending or so, now try to wiggle your kneecap around. And you'll see that there's a lot less movement. And the reason for that is when our knee is in a straight position, the kneecap is floating. It's not engaged inside the groove. As we go into more of a bent position, the kneecap compresses into the underlying bone. And that's normal. That's what should happen. The problem, so what we call that compressive force is the patellofemoral joint reaction force. Francis, can I see your screen to put up some pictures?
For sure.
Um, Thank you. So I'm going to show you a picture in a second here. If I can figure out how to do this, but I am very technologically
There you go. Let's switch
challenged.
screen. So
There we
everybody
go.
should
Perfect.
be
So the
able.
diagonal line that's labeled the PFJRF, that stands for patellofemoral joint reaction force. So basically what that's showing us is the amount of compression between the kneecap and the bone underneath it. And that force, we're going to talk a little bit later about activities or whatnot that load that more than others. But basically what ends up happening is that the cartilage on the undersurface of the kneecap becomes compressed or wedged in between the two bones, the kneecap and the underlying bone. That cartilage, when it's healthy, it's actually the thickest cartilage in the human body. It's 5 to 6 millimeters thick. And over time, if those compressive loads aren't managed properly, that cartilage ends up being affected. And then there's wear and tear to the cartilage that can create some problems. So, Francis, do you want to talk a little bit about what causes the wear and tear to the patellar cartilage?
Yep, for sure. To start, let me close that picture. Let's do a little bit of anatomy. The first one will be the legs anatomy. So in the legs, we have the quads. The quads means four muscles. So there's four big muscles in the quads that you can see in the picture right here. Three of them are starting with vastus, and one of them is rectus. So vastus lateralis, which is lateral to our leg, the outside of our leg. There's intermedius, it's in the middle, and medialis, which is inside of our legs. There's also the rectus femoris. All these muscles, I don't know if you guys can let me play a little bit. All these muscles are connected to the patella right here. All right, so by a tendon, and it's all around the patella. So you see the patella is right here, right below. I'm really bad at drawing, but it's right below the tendons right here, and they're all connected to that patella. So there's a lot of pressure coming there. Some pressure are stronger than others, and that's where the syndrome comes in. So when can I write or am I erasing?
I think
When
you erased it.
the yeah, it doesn't want to stop erasing. Go and write, please. All right, I'm not going to draw anymore. So when the vastus lateralis is stronger than the vastus medialis, there's a lot more pressure going outside of the leg than inside of the leg. So we call this disbalance in muscles, and it could be that can be a cause of the PFS. And right here, I'm just going to move to another picture. There's also another cause. There's multiple causes, but when the muscle is putting more pressure from one side than the other side, the patella tends to move on the outside. So he will be off the track of his normal groove that it's in the femur and in the knee joint itself. There's also ligaments and tendons right here on the outside of the leg. If it's really tense, a lot of tension, it will also create a pressure going on the outside of the leg. So these are multiple factors that creates the PFS syndrome. Like Gian said, it creates friction because the patella doesn't stay in the groove, the normal track of the knee. There you go.
Hmm. Okay. So when the kneecap pulls sideways, instead of the force or compression being balanced throughout the entirety of the cartilage, part of it becomes more loaded than the other. And I'm just going to show you a little picture here, if I can get this up. Yeah, there we go. So you can see on the left-hand side of the screen, that's a patella that's sitting normally. It's an x-ray, actually, of a patella that's sitting normally. You can see that the space between the patella and the femur is equal throughout. If you look over to the pictures on the right side of the screen, this shows both knees side by side, but you can see how those patellas have really been pulled outwards to the outside. The spaces aren't even, and as a result, the cartilage becomes worn in those areas of higher degrees of compression. So in addition, so we have basically, again, the quads muscle and balance that Francis talked about. So the patella will pull toward the strongest quad, which is typically the outside one in the case of dysfunction. We also end up with a situation with alignment. So if our legs, our femur bones, or thigh bones rotate inward, the patella will be relatively outward compared to those. And that's also a cause of patellofemoral syndrome. What causes that inward rotation of the thigh bones is weakness in the hip and also overpronation of the foot. So what we often see with knee pain is the knee is actually a victim of what's going on with the foot and or the hip. And then the knee is the unfortunate piece that's in the middle. So now we're going to show some pictures of the cartilage and what it can look like with when this situation arises.
I'll do it.
Oh, you'll
All
do it. Okay,
right.
thank you.
There you go. So over time, there's 4 degrees of degradation of the cartilage inside the knee. So yeah, you don't really see the picture right here. It's pretty light, but what you could see is the first of all, this is kind of obvious. This is first degree, and over time, you see that it kind of increase and goes really chaotic after time, and that's caused by the pressure that we put on the patella, which is not following his normal path. So you don't want to get there. You want to stop it before that for sure. Obviously during the time. So Jan, what are the symptoms?
So people with patellofemoral syndrome will typically present with pain and pressure underneath their kneecap. So the front part of the knee, but behind the kneecap, they'll say, that's where my pain is. Often they'll feel a feeling of pressure. They'll notice this more with loaded bending activities. So things like stairs, squats, lunges. And also people with patellofemoral syndrome, one of the cardinal signs of it is they don't like sitting for prolonged periods of time. And that's because, again, like the little demonstration I had you do, as the knee is engaged at 90 degrees of flexion, there's a fair bit of compression of the cartilage. And if it's already inflamed, it doesn't like that, even with no extra weight on it. Sometimes we see swelling, not terribly often, but sometimes, and we'll often see atrophy of that inside quad muscle. It kind of disappears. Instead of looking like a nice plump little teardrop on the inside of the knee, there'll be like a hollow or a divot. Oftentimes, people will report giving way and less likely locking, but sometimes for sure. But giving way is very, very common. Another common thing, and again, just based on that picture you can see right now, you can see the roughness underneath the kneecap. People will often describe crepitus or joint noise. So it kind of sounds rough or kind of crunchy when they bend. So the next thing that we're going to show you here, which is really interesting to me, but I'm kind of geeky, are the patellofemoral joint reaction forces. So this just shows you, again, back from that picture, the degree of compression between that the cartilage is undertaking between the patella and the bone underneath. Francis, are you able to bring up that graph?
For sure.
I'm having trouble, sorry.
Yeah. Gian's using an iPad and it's not optimal. It's
There we go.
to manipulate. Let me find a spot for
Perfect.
that. There you go.
Yeah, we got her. So here, probably of most interest are the two columns towards the right. So this just shows with different activities the amount of compression there is of that patellar cartilage. And I mean, again, we're talking about a very small surface area. So with walking, you're looking at about half of your body weight. Biking the same. As we get into stairs, jogging, squats, you can see how those compressive forces really increase. So with a deep squat, we're all the way to 4,000 pounds of compression of the cartilage between your kneecap and the underlying bone. So pretty significant. So I like people to be aware of this just because it can help guide your activity, particularly in symptomatic people.
Yeah. And the numbers on that pictures, as you guys can see, it's for a 200-pound person. Um, so it does vary for the numbers, but 200 pound. If you weigh more than that, just imagine that it's going to be way more pressure in pound
Mhm.
going into your body. So, what kind of treatments that we do when we go see the physio?
So our primary goal in the acute phase is to reduce pain and swelling. Interestingly enough, the that inside quadricep muscle that tends to weaken, it doesn't function well in the presence of swelling. So in order to retrain that muscle, we have to minimize that swelling. So we do that through activity modification. We might use some different like physio-specific machines to help with pain and swelling to get you through that acute phase. There may be a role again for medication. We also need to ensure full range of motion, particularly into full straightening or extension. Another issue that we have with strengthening that inside quad is it's only active in the last 50, or I shouldn't say only, it's most active in the last 15 degrees of straightening. So if you can't achieve full straightening, we're really not going to do a good job of strengthening that muscle. We'll often stretch or mobilize the soft tissue on the outside part of the knee because that tends to become tight. So some hands-on therapy for that. And our approach to exercise is very individualized. Basically, we need to stretch what is tight and strengthen what is weak. And there is some variability patient to patient what we see that way. So typically speaking, lengthening, we're looking at hamstrings, quads, your IT band, and your hip muscles. And then in terms of strengthening, again, that inside medial quad, that's very important, as well as your glutes. Good glute function is very important in this condition. Another thing that we have to do in some cases is neuromuscular electrical stimulation. And basically, that retrains that medial quad. Sometimes the brain forgets how to recruit it, and using the electrical stim can sometimes be a reminder of, okay, I have a muscle here. This is how it feels to contract that muscle, just to initiate that process. We'll often sometimes provide specific bracing if required, as well as insoles if pronation is an issue. Again, obviously not if that isn't a problem. And there's also some types of taping that we can do to help guide the patella in its groove. The good news is that most people with PFS will resolve with conservative treatment. I think they say 90% within 6 weeks will be pretty functional. For those who fail to respond, there are some surgical options. Those are not used often. They're very much used as the last resort. The real aim is to reduce pain, reduce inflammation, and then resume activity correctly in order to prevent recurrence. So, Francis, can you give us some tips for exercise for this problem?
For sure. Like Gian already told you guys, the way I see things as a reconditioning specialist on my side is when the pain occur for the first time, it's most likely because of a false posture or not a good posture doing something. Now, when I say something, it's not like only doing squats, for example. Like people who love squats, that's good, but it's not the only factor that creates the injury. It could be anything. Now, let me just show you before explaining why am I saying this. What can cause the PFS? So, oh, let me switch screen again. There you go. Now we have a different posture of our knees. Now, let me move that picture also. So as you can see here on the picture, let me draw again because I like drawing. This one right here should be a normal posture, depending on obviously the stature that you have and also the gender. The women's are more wider, the hips is more wider than men's. But the main goal of that exercise here is saying, like, I don't know if you guys see it, but it's lines. I can't even draw a straight line, but I hope you guys see it. It's having a straight line with our knee, hip, and our second toe right here. Okay. Now, there's one type of legs posture that we can have during sports or during chores or during even like standing. It's the varus. Varus means that your body will be in a V mode, just like this. I think I already told you guys I am terrible in drawing. But the other one, which is the PFS, is most likely caused by the valgus. So it's the opposite one. It's like the knees are going inside. You can see it right here. The knees are pretty much inside, which create pressure right here on this side of the knee. Oh God, I'm terrible on drawing. Let's erase that. And it's gonna create pressure on the outside of the knee, and then a release. You can see the release pressure on the inside here. So valgus situation can be also created with your ankles. As you can see, if your ankles are inside like this, it can create the valgus situation here. Now, the valgus, I want to stop drawing because I'm terrible at it. Can I erase that though? There you go. Oh God. Okay. So the valgus situation, you can see it in a couple things. I found some pictures. Um, which one was that?
I think it's under posture.
Yeah, but there's another one sports. You see here that picture. Gian is not aware of that, but that picture you can see sometimes in basketball. That's not really the best picture to explain the valgus situation, but you could see her knee going inside a little bit. I saw. I don't know if you guys are really watching the on Netflix. There's like the Bulls with Michael Jordan video, and you can see him shooting once. When he shoots the ball, when he's gonna land, his knee is going inside. That is the type of valgus that I'm talking about. So it can happen to any kind of exercise that you guys are doing, even like going downstairs. Sometimes if your knee is not stable or your quads are not strong enough, you will have a valgus situation. So you can see here another picture of that kind of situation. So I don't know. I'm pretty sure you guys saw that video. It's a fail army video, something like that. But that guy is trying to lift too much weight, obviously, as you can see, because his hip is going one side. Also, his knee is going inside. His feet is not even straight. There's a lot of errors on that picture. And obviously, if it's a video, like if you see the video, you'll see how it ends up. It's not pretty. But yeah, there's some risk of injury when your body is not following the weights that you're trying to lift. So good posture, bad posture when your knees are going inside. Now, when I'm saying this, it's also the bad posture, the valgus. Everybody does it at one point when you're doing something. For example, even me, when I'm gonna jump on the squat rack and then I'm not being followed, I'm not, there's no spotter, there's nobody following me. I might do the valgus situation because I don't see it and I don't really feel it. I might feel it, but most of the time you may not see it or feel it, and you will have that posture. So that is a sign that first of all you're tired. You're too tired to do that weight. For example, this weight. If I take that example, um, reduce your weight, reduce your rep, or stop the exercise and just fix your situation. If it's a chronic thing, like it comes every time you do squat, obviously you need to start with no weights. And actually, when we teach people to do squats for the first time, we want them to start without any weights on the bar and sometimes without bars. We're just grabbing a dowel, and we do the posture thing first. I think I do have a picture here. So this would be a proper posture for a squat. Um, Obviously, you can wear a t-shirt. It's not optional to be shirtless. But what we're looking for when we're doing a squat is having a neutral spine. The neutral spine, that can be even another topic, but what we're talking about is your body is have normal curves, and you want to keep the normal curves in your spine. You just don't want to amplify the curves. You want to keep your body straight. When we're talking about the lower body, this is what it's a little bit more important. We're talking about triple flexion. So the triple flexion, we're talking about the hips. Hip is the first joint that's going to flex. The knee is the second joint that's going to flex. And the third one is the ankles that's going to flex. Triple flexion. So you want to make sure that these three are flexed. Also, the center of gravity will be in the middle of your foot right here. I don't know if you guys see my muscle. Yeah, because I don't want to start drawing again. It's going to be chaotic. So your center of gravity, you want it to be in the middle of your foot and in the center of between these two feet. This is what you want to do when you're doing a normal squat. Now, like Gian told you, do you need to do a full deep squat? I don't think so. It depends on your type of physical activity that you do in your life. So I wouldn't recommend it. And there's a lot of pressure going in your knee when you're doing this. So just keep that in mind. Um, Now, to fix that issue, um, you also need good shoes. I don't have a good picture for that, but shoes can help to keep your foot stabilized and having a good posture in your feet when you're doing the exercise, and also to prevent the overpronation. Um, what you can also do, I'm trying to not talk, I'm talking already too much. So um, there's another thing. These are a type of exercise that you can try to fix. So when you have a valgus situation, remember, it's when your knees are going inside. What you want to do to fix that is using TheraBands. So when you use TheraBands, that's going to help you because that's going to put pressure on your quads directly. When, like this picture right here, you can see that it's directly on the quads. But the big question is, like, is this good? Because you're kind of amplifying the valgus situation. And the answer is yes, because that's what you want to do. You want to create more valgus situation so you can, like you see on the picture here, pull your knees apart to fix the problem. So to have a little bit more pressure and fix the posture when you're doing it. So obviously the pressure of your tower bands can vary. The collar will tell you what is the pressure, and you go progressively in that kind of exercise. You can even do it when you're doing lunges, as you can see in the picture above. So it's like different type of exercise, but you want to do it with the TheraBands. It's very good. I like to do it with TheraBands. Am I forgetting something?
The
There's
TheraBand will
also
facilitate you. The TheraBand will facilitate use of the muscles that pull you out of a valgus position. It's a cue to use those muscles.
Also, there's other exercise. What I like to say is you want to know the cause. When I started to say it depends, you want to know how this injury happened. So when you start going to see the doctor, Gian or me, we're going to ask you, like, how did that happen? Like, was it just by doing a typical exercise or something like that? And if we want to know how you did that exercise or how you did that injury. So, for example, if it's squats, that's kind of easy. If it's like playing basketball, now we know that when you're playing sports, you're creating a vacuous situation, and we want to fix that. So on my side, I want to work on your posture when you're playing sports. So that's another way to try to fix that problem, to balance the quads when you're doing any kind of stuff and prevent that injury from happening. The other thing is sometimes when you're having a too much narrow uh, fitness lifestyle, like actually you playing too much just one sport itself, you're just going to create or develop more stronger muscles on one side than the other one. So that can create also a disbalance. So we're going to try to find a way to have a better balance. And there's other, that's why the training at the gym is very useful, because this is where we can isolate some muscles that you're not used to do in other sports. Um, so with that said, you guys are seeing that there are some people waiting. Thank you. Um, Let me continue. This isn't my way. All right. Some exercise that you can do. Let's show you guys. Okay. Thank you. Some exercise that you can do is these five exercise. Now, you need to know that there's a lot more exercise, but what we tried to find, me and Gian, is some exercise you can do at home with no equipment or almost none. And it's kind of like a good startup with your knee problem. Sorry. The first one would be this one right here. So you can lay down on your back, having one knee at 45 degrees, just to have it a little bit more stable, because you want to also keep your hip stable. And you have your legs straight. You see that your toes are pointing the ceiling. You don't want in that exercise your toes pointing one side or the other. This exercise is your leg is straight, your toes facing the ceiling. Now, what you do
Actually,
is you
I
go.
often get them to lateral, turning out a little bit actually can really facilitate that
That's
VMO.
that's the third exercise. But this one
Oh,
here,
okay.
you're gonna raise that leg up. As you can see on this picture, the legs are gonna be straight up, and now your quads is gonna be engaged. You don't need to have like a parallel or a vertical raise. You don't need to raise it as high. I would say a good reference would be the other knee. As soon as it's at the same level as the other knee, that's good enough. You want to feel that pressure in your quads. Now, when you're gonna come back down, this is where you're going to do a negative contraction. So you want to resist your leg by coming down, and that's going to create a lot of pressure in your legs. You do it a couple times. Obviously, you want to do both sides, even if it's your weak side is your left leg. You want to do both legs. So that's the first one, the first exercise. Let me jump to the third one. You'll see, yeah. So you'll see that this one here, there's a rotation. So the exercise looks the same. The only thing is the hip is on the ground like this, and it's on the ground. It's like stable. The picture doesn't really see it, but there's a rotation on your foot. So you rotate your foot up, and then that's gonna focus on the inside of your quads, and then you do the same thing. All right. When you come back down, you're just gonna want to resist the motion. You want to take more time going back down than going up, and you can do the other side too with your toes facing inside also. The third exercise is you're laying on the side. You can put your legs in front or in back, it doesn't matter. I prefer in front because your hip is more stable. That's literally up to you guys. And then you're gonna raise that leg up, and then you do the same thing, you go back down. Now there's other exercise. Obviously you can do the full circle. Okay, that means you can do um, your back legs muscles, you can do your quads, you can do the other side also, the leg raise, side leg raise. So these are also exercises that you can do, obviously during that type of reconditioning that you do. um, Now, the two other exercises I'm going to give you guys, the foam rolling. So, if you do have a foam roller or anything that is cylinder and a little bit strong, I saw some noodles that you can use in the pool. You can do it with that. If it's not, if it's good enough for you, that's good. And then you're just going to roll from one joint to the other joint. You don't need to put pressure on the joint directly. You can stop before that, but it's foam rolling, so that's going to relax the muscles. Sometimes people feel some kind of like feel pain when they do it, but the more you do it, the more you're going to feel the muscle relaxed. So what you want to do here is you want to work your IT band because that can contribute to the pressure on your patella, and it's going to bring the patella on the outside of the knee joint. The last exercise, I want to go a little bit faster. This one is the IT band stretch. So what you do is you cross your feet just like she's doing right now. You're going to bend forward and you're going to try to touch your toes. By doing this, you can also move your hip a little bit sideways. That's going to increase the IT band stretch. So you can do that. You can do that by just putting your butt on the wall and then just lay down. Just have an inclination if you prefer it like this, or you can just do it by standing. That is totally up to you guys. You can try it at home. So as you can see, these exercise no need of equipment but a foam roller, and you can do this stretching static position at least 30 seconds, and foam rolling you do it like not more than 4 or 5 minutes because that's going to be way too long. And these exercises, I would say 10 reps. Start with 10 reps and increase, see how your body feels, and increase the reps as you go during these exercises. So that's a lot of talking. I don't know if I forgot something. I hope not. Do you have anything
I
to
just
add?
sorry, front. Yeah. So what I would really encourage is, you mentioned it briefly about cross training. So we want to like, there's nothing wrong with doing deep squats. There's nothing wrong with, again, on that continuum of that chart of doing some activities that do have increase your patellofemoral load. However, you don't want to do them all the time, and you do want to do them well. So mixing in activities that don't involve that degree of load, be it swimming, skating, cycling, as opposed to always running, always doing deep squats, those highly compressive activities. And the other thing is that when load matters, and so managing loads is really important. As we saw in that continuum, a lot of those we use body weight as a way to calculate patellofemoral load. So our weight matters, and not only body weight, but also extraneous weight, whether that's using a rucksack, dumbbells, barbells, that kind of thing. So again, loaded activities are not wrong, or they're not bad, but they need to be done in combination with other things, and they need to be done well. So when you're doing those high load patellofemoral activities, make your form has to be very, very good, or there will be consequences. So that's kind of all I have.
That's an excellent point that you're bringing in. Also, guys, I probably forgot, and I'm kind of surprised that I forgot to mention something. When you work out, as Gian just said, if you're working out with a partner, your partner can be really useful by spotting you when you're doing the exercise. So if your partner knows what is a valgus or a varus is not good too, you want him to correct you. So you want him to do some correction while you're doing the exercise. Now it's not a competition who can lift more weights than the other one. It's more like progressively together increase the rate and increase our fitness. So you got to train smart. You don't want to train too fast or increase too fast the weights. You want to make sure that you do everything properly. So that's why a partner at the gym is very, very useful. Also, if you don't have a partner, you can use a mirror. We do have some mirror at the gym, so you want to watch yourself, be looking yourself in the great posture, or like if it's the face, the front of your body that you want to watch, just try to find a mirror that you can do that exercise while watching you doing that exercise. And the last thing is, if you don't have a partner, there's no mirror. There's PSP staff, so go at the front desk when the gym's going to be open, obviously, and ask for PSP to help you spot or make sure that you're doing everything correctly. And we are here for that, so we can like obviously supervise your progression when you're at the gym. So these are really good points that you guys can use. So on Facebook, I did ask if people have a question. Doesn't look like it. I think it's because I talk too much. Um, but we do have two persons waiting to join us on Zoom. Now, there's only 5 minutes left. I just want to let these people know that there's only 5 minutes left. I'm gonna invite both of them together at once, and just make sure that you unlock your mic and your video. So we have Tracy J and Ryan. Can we do a test? Can you hear us, Ryan? And can you talk? Can we do a test? Can you hear us, Ryan?
Yep. Can you hear me?
Yes. So Tracy, can you like have a headphones or something that it's gonna shut down the volume because we hear ourselves in loop?
Can you hear us? Oh, so you want me to get?
Yep.
Okay, I
Can
need to
you
go
hear
and
me?
get some. I'll be back. You can hear me
So
though.
Tracy, can you like have a head? So I'll mute her. Meanwhile, but Ryan, since we can hear you, go ahead and you have some message for us.
Yeah, sounds good. I'm actually the Comrec supervisor here at PSP Wainwright, and I just wanted to promote a couple events that we have coming up. One of them is actually tonight, and it's going to be a weekly run event of trivia. It's going to be starting at 10. The winner of each week will be then entered in for a draw here coming at the end of May, and it's going to work out to, I believe it's a $50 gift card to Canadian Tire for any of your quarantine shopping you might have. And if you register by 4 p.m. today, I know it's only we're getting down to the last 15 minutes here before the deadline's there, but I will paste the link into the comments. So everyone, if they are wanting to, that's here.
It's already there.
Oh, perfect. That's awesome. And yeah, you can check us out and follow us on the Facebook page for that. And then also too on Sunday night here, starting at 7 o'clock, I myself will be hosting a charades night. It's going to be hosted via Zoom, kind of through this method here. And over the next little while, or probably within the next day, I'll get the link out for that, and we can make sure people are able to sign up for that if they want to. So thanks for having me on here, Francis and Jan, and I'd be glad to come back another time.
Awesome. Let's see if Tracy has fixed her problem. So I did unmute you. Okay, can you try to unmute yourself?
Sorry.
There you go. Awesome.
Can you hear me now?
Yep.
Yeah. Okay.
Oh, yeah. Go ahead.
Okay, awesome. Thank you. So I have been watching Gian and Francis's podcast, and I asked him if we could come on and if he would talk about.
Yeah, we still hear you. We hear you, Tracy.
Okay, sorry. It's just there's a delay. Anyway, I asked Francis if I could come on or if he would talk about some of our programs. So he invited me on to talk. I think it was too many things to remember. Anyway, so we are going to have some things going on locally. We always do a motivational Monday. So encouraging people to get out and do some exercise. So this week we're encouraging people to get out on their bikes. And I did see Francis out this week, so that was good. Wednesday, we do a walk around Wainwright. So encouraging people to get out and walk, and we give a little route. We try to do some inside and outside of Wainwright. And on Friday, we always do a recipe. So this week it is peanut pretzel squares. So check those out. And also on Friday mornings, I go on Facebook Live to talk about all these things that are going on as well. So just so people can get some ideas. As well, nationally, Health Promotion does some webinars. And you can get on those by going to CAF Connection and choose virtual services and then go to HP webinars. There's a few series going on right now, which you can have started, but you can still join them. There's one on mission nutrition, so healthy eating, resilience building, managing your anger, some healthy other healthy eating, some addiction ones as well that are going on, and also some communication ones. Tomorrow as well, there's one that's stopping smoking, and it's going to run for 8 weeks. And there's also one next week starting about sleep, and it's on Mondays and Wednesdays, and it runs for 7.
Ah, shoot. Sorry about that, guys. I don't know if you hear me. No. Yeah, I think you guys hear me. So the Zoom is has stopped when Tracy was talking. I'm really sorry about that, Tracy. So we're just gonna like stop that podcast right now. But if you need more information, just send an email to Tracy, and she will be more than happy to give you all the information. So see you guys next time. Next week we're gonna talk about pain management. So can't wait to see you guys next week. If you have any questions about that, let's just send me an email or Deanne and an email, and we will see you guys next time. So till then, be safe, stay healthy, and happy. Bye.